Hey everybody, how's it going? I'm Dana. I'm the Director of Brand Communications here at Beyond Type 1 and just going live right now, about to be joined by Dr. Mark Heyman to discuss some mental health, coping strategies, questions for people with diabetes during COVID-19. So say hi, we're just getting started, and let us know if you have questions. We've been sourcing questions about mental health over the last 24 hours from our community, and I'm excited to get to talk to Mark and get some of those answered for you. But if you have questions, feel free to ask away too. Let's see, get Mark on screen now. Hey Mark, how's it going?
Hey, good. How are you doing?
I am good. Thanks for joining us live today.
My pleasure. My pleasure.
Yeah. So I was just kind of getting started, introducing myself. I'm encouraging people to ask questions live, but like we've been sort of sourcing questions from the community about mental health and COVID-19. I think there's a lot to talk about right now, certainly in general for everyone around the world, specific to the diabetes community as well. So do you want to just say hi, introduce yourself, tell us a little bit about where you're at right now?
Yeah, sure. Well, I'm Mark Heyman. I'm a diabetes psychologist. So I work with people on their mental health issues related to diabetes, and I am currently in San Diego in my home office. So happy to be here and happy to be a resource for the community.
We're so grateful to have you. I was just telling everyone, Beyond Type 1 staff has been working from home for about a week now. We are in the Bay Area where we are on, we have like the shelter in place order is relevant for us right now, which honestly, I think we're kind of trying to embrace and really take on this flatten the curve mentality, keep everybody safe and healthy. But it definitely is bringing up a lot of mental health questions and concerns about what this means right now for people with diabetes and sort of planning longer term as well.
Yeah, for sure.
So with that said, I think we'll just jump into some of the questions that we've been asking around over the last 24 hours or so, sourcing from the community what people want to know. I'd love to talk specifically about diabetes head on. I think there's a lot of information out there, but not enough information, and everybody's trying to assess their own risk of both becoming ill with COVID-19, but also of serious illness and the scarier pieces, death, those things. We're seeing a lot of scary statistics. We don't know a ton. We've been kind of asking experts, what does this mean for our community? We're figuring that out, but regardless, what's your advice for someone who's just feeling fear because they're trying to figure out what their risk is and it might be high?
Yeah, so I think the first thing is recognize that you're scared. I think that we're all scared, and I think that by recognizing that and just acknowledging that in yourself, that's the first step. And it's okay to be scared. I think that to some extent we want people to feel anxiety because anxiety pushes us to action. It pushes us to learn more. It pushes us to get more information. But it can also take us to some pretty crazy places, and that anxiety can go overboard. So what I would really encourage people to do in terms of their anxiety is really stick to the facts and also stick to reputable sources. I know that you guys did an interview last night with Dr. Peters, who's an awesome source. I know that she also has a video that she made on Medscape a couple days ago, which is an awesome source of information. But I think that kind of arming yourself with the facts. The facts can be really scary, and that's okay. But we want people to be armed with that information, because if they're armed with that information, that they can take action. The challenge comes when we start, listening to rumors and kind of going and with information that may not necessarily be true, and then things kind of get rolling in our heads, and the anxiety becomes overwhelming because we really want to grab onto something, and when we don't have good information to grab onto or scary things to grab onto, we allow our mind to kind of go to roll. And that's where things can really get challenging.
I think that has come up is like, do you have any tips for people who want to remain informed but don't want to get overwhelmed? Like, where do you draw that line? How do you cut yourself off and just not stay scrolling through Twitter all day? What's like a good level there?
Yeah, I don't have a great, I think that's an individual choice.
Yeah.
And I think it's a little ironic we're saying this on Instagram Live because, I think the advice I would give would be to get off social media, or at least limit yourself on social media to certain amounts of time. But I think that, checking the news in the morning and checking the news at night is a good thing. But when you start, scrolling through Instagram or Twitter or Facebook, that's where all of the conspiracy theories start coming. And that's where all of the information that may not be grounded in facts and people's opinions kind of come into play. And whilst those are really valid, and I think that for some people that's a really great outlet to express their anxiety, for other people that's where their anxiety can really kind of take off. And so I think that it's a good idea, to set some limits and at least take a news and social media break. Trust me, if something happens that you need to know about, you'll find out about it. You'll get a push notification on your phone. Yeah. Your mom will call you. But to be able to just kind of take a break and limit yourself for your own mental health, read a book, watch Netflix, call a friend, and limit yourself to information in small chunks. It's changing fast, but it's not changing that fast that you need to know about things right now.
Yeah, I can say for myself, even we're working really hard at Beyond Type 1 to keep the diabetes community informed. So I hope that we can be a reputable source for you, and we're trying to publish new things every day, but picking a few places. So for me, what we're creating at Beyond Type 1, my local news has been really great, just finding out what's going on around me, but keeping it a little bit more local for me, and picking a couple places that I'm looking, I know I'm going to want to check in probably daily, but once I've done that, I need to find something else to do.
Yeah, one thing I tried to do is to try to limit my use of my phone and the TV and the internet at night. So, when I'm done working for the day, at 5 or 6 o'clock, try to turn it off and, enjoy time with my family, enjoy doing things that I can do at home, and not wake up in the middle of the night and check things, or not look at my phone as soon as I get up in the morning. I think that sort of break and that sort of be able to de-stress and focus on what you have at hand, what's, in front of your face, your family, your friends, and, focus on that can be really helpful as well.
Yeah, absolutely. I think shifting that focus, I think one more challenge that's coming into play, we're certainly seeing it here in the Bay Area, but I think as other places follow, people are figuring out where the place is for them to shelter in place. Maybe we are a little more isolated from friends, certainly maybe family in some cases, and everybody's kind of taking a look at that. Do you have any tips for people who are suddenly feeling isolated because they're trying to practice social distancing or staying home?
Sure. I think that some creativity is really at hand here. Finding ways to connect with people not in person. So doing things like using Skype or FaceTime, texting, writing letters. And I think that, and really making an effort to reach out. I think that it's the upside to this whole situation, if there is one, is that I've really seen the community, whether it's the diabetes community or just the community in my area, come together and really want to support people in whatever way that we can. I have a group from church that I meet with on a weekly basis, and we met last night over Zoom. It was awesome because we want to stay connected, but we know that we can't get together. I also think that it's really helpful to think about our neighbors and think about people who we know who also may be isolated, who may not reach out, and be proactive and reach out to them. Being a good neighbor at this time, I think, is especially helpful and can give you a sense that you have the ability to help something, do something greater than yourself by reaching out to someone who's elderly or reaching out to a friend who lives alone. That can be a nice thing to do. Yeah.
So I think we should definitely get into some just general coping mechanisms for stress and anxiety. A question that I've seen come up repeatedly is people who are having issues specifically managing blood sugars when their stress levels are acute and rising. Any tips there?
Well, a couple things. One is cut yourself some slack. This is these are stressful times, and we know that stress is gonna raise blood sugars. And so, I don't want to say it's okay, but it's okay. Life is more than diabetes, and we want to be able to, you want to. I think that's a good lesson for anxiety in general. But we want to be able to think about the things that we have control over and let go of the things that we don't have control over. And so you have control over diabetes management to a certain degree. You can take your insulin with meals, you can eat right, you can exercise, you can do all those things. But we know that your blood sugars don't always cooperate with that. And if that's the case, I think cutting yourself some slack can be helpful in that regard. Also, reach out to your doctor if you're having lots of trouble and you feel like your basal rates need to increase. I know that my doctor and lots of the endos around are really helpful and really wanting to be here and available during this time. So, take some practical things and do things that you can control. Those are, in terms of blood sugars, that would be my advice.
Yeah. Yeah, I think we're seeing people also talking about burnout, and I think it's hard because so many of us are managing our mental health and our diabetes all the time. And then when you add this layered on top of it, people are also, there was discussion out there on social media about like, what if this is causing me to start feeling burnout? I think people take a look at their lives and their diabetes, and it can feel really overwhelming. So I don't know if there's anything more to say about that. I think cutting yourself some slack goes a long way, but if burnout is also in the picture, like diabetes burnout right now, what are your thoughts there?
Yeah, a couple of things that I would mention is, one, I think that the language that we use is really important. There's a difference between saying I am burnt out and I feel burnt out. And I think that the reality is that all of us are feeling anxious and feeling burnt out right now. But if we say that we feel something, that gives us the ability, that gives the feeling the ability to change at some point. And so really watching the language that you use. Also with burnout, we want to make sure that you're managing your diabetes to the best of your ability right now, even with everything going on, because it's going to make things easier to deal with in general if you do that. And so the advice I would give there is, we can't snap our fingers and make you not feel burnt out or help you not feel that way. It's not quite that simple. But if you think about what are the top two things or the two most important things that you can do, that you can commit to doing every day to manage your diabetes. So for example, if you're on MDI, taking your long-acting insulin is number one. Or if you're on a pump, making sure that your infusion set is within 3 days or whatever the regulations for your pump are, and keeping that on, bolusing with every meal, and kind of doing, like, basically checking those boxes and doing the best that you can, because we want to make sure that if you're going to put effort only into certain areas of your diabetes, and we hope that you're able to do it in all cases, in all areas, but we know that that's not always possible. We want to make sure that you're getting the most bang for your buck, and we want to make sure that you're healthy, so that, one, you can deal with the stress, but also so that you feel well enough that you're not bogged down by high blood sugars where you're feeling like it's gonna be more challenging for you just to cope with the day. We know that you and I both know, living with diabetes, that high blood sugars make coping with the stress of life a lot more difficult. And we want to make sure that you're doing everything that you can to take away that barrier. And I think, finding ways to make sure your blood sugars are in a generally good range is helpful. That being said, now might be the time to think about changing the alarms on your CGM, so that you're not, if your CGM is set at 180, I'm not telling anybody what to do, but think about upping that so you're not getting alerts all the time, reminding you about how out of range you are. We want to keep you safe, but we also want to make sure that you're not overwhelmed by the numbers, by the alarms, and by diabetes in general. Yeah.
I think it's helpful for sure to think about some of the specifics, both when it comes to dealing with mental health right now, as well as diabetes. Like, it's definitely been helpful for me to focus on, like, what can I do without feeling like I need to do everything, right? So balancing, like, I am helping by staying home, taking care of myself, making sure that my house is a safe place and as happy as possible place for me to be. Like, that is also helping the big picture. So I think without necessarily feeling like you need to take everything on at once, also reframing what you are able to do as being helpful, and focusing on things like routine, just like getting up at the same time every day. I mean, you mentioned on the diabetes side, like, just small goals, like take your long-acting insulin at the same time every day. I think it extends into life in general right now for everybody. Like, get up out of bed on weekdays at the same time every day, or when it's hard, but those little things really make a difference.
Yeah, that's exactly what we tell people who have depression. In terms of just making sure that you have a structure. Having structure gives us a sense of security. And if you think about anxiety as being not knowing what's going to happen in the future and being worried about that, certainly there's lots of that right now. But giving your sense of, I know that tomorrow morning I'm going to get up at 6:30 and I'm going to have my breakfast and I'm going to take a walk around the block. That can give you a sense of grounding, which is really helpful. Also, again, reminding yourself and remembering that there's lots out there, tons out there that we have no control over. We just don't. But we also have tons of things in our own lives that we do have control over. I can decide not to go out of my house, or I can decide to stay 6 feet away from everybody, and I can make all of those decisions. And that is going to have an impact. And so, really focusing on the things that you have control over and recognizing that you're anxious about the things that you don't have control over, but there's not much you can do about that. And so feeling anxious is okay and recognizing that's okay, but really trying to grab onto it and control it, that's where things get really messy. Because if we try to control things we have no control over, you're setting yourself up for failure, and then you feel even more out of control.
Yeah, absolutely. So I want to open it up. I know some people have been putting some questions in the comments. I would encourage people to do that, especially things about mental health and diabetes. I know there are some questions that are a little bit more on the management side. I would encourage people to go check out some of what we've published. Mark referenced our interview with Dr. Ann Peters, but when it comes to some of the endocrinology side of things, we're working on building those resources for you too. But if you have questions about managing anxiety, how your diabetes and your mental health are intersecting in the world right now, I think it's always a topic, right? And at Beyond Type 1, we're always trying to talk about mental health and diabetes, but suddenly taking care of your mental health has been thrust to the forefront of everybody's mind. So this is a cool opportunity to talk to Mark and let us know what else you're looking for from Beyond Type 1 and how we can help the diabetes community right now. I think we're looking for that. I think I have one more for you, Mark, and I'm curious to get your take. We've been talking about this as staff at Beyond Type 1, but we've been talking about this issue of how do you respond? So this is kind of a specific question. When people say, or you see people on social media say, well, don't worry, it's just like old people and sick people who are going to die from this. How do you handle that with the amount of information we have, the risk we know and don't know about, but also just maybe it's someone who you like and suddenly they're saying something that they don't even know is hurtful to you. How do you manage that?
Yeah, so I think we've all actually answered this question before in a different way. Yeah. I don't know anybody with diabetes who has not dealt with the question of, did you give this to yourself, or did you get this because you ate too much sugar? And we all have a pretty, I think, hopefully we have a good response to that, where we're able to help people see that what they're asking us is not appropriate, but also not true. And I think that using that same strategy that you used probably your entire life around diabetes with this can be also really a helpful tool. You really stick to facts and stick to there's lots of information coming out that's kind of scary about this impacting younger people, but really kind of come back at people with facts. Also recognizing that this is a community issue, and so even if that's true, I don't want to be a carrier to impacting my parents or my grandparents, and letting but coming back with a calm and but firm response to that, because if you say you're right, you're right, or don't respond at all, then that perpetuates the myth and also makes us all feel bad because we're not helping, and people with diabetes, some people with diabetes we think are at higher risk. We don't know for sure. This is all very new to all of us, but I think just coming back with a calm but firm response is based in fact. And I think that Dr. Peters has lots of good information in what she's recorded on this that can really be helpful with that.
Yeah, absolutely. I think everyone in the world right now is dealing with what we know and what we don't know and how to make choices based on that information. It's especially true for people with diabetes. So I think acknowledging that there are some things we know, there are some things we still don't know about risk, but I think that strong but firm response and trying to keep it in facts. And something that's been really helpful for me is just accepting that there are things we don't know and can't control, rather than just sort of ruminating on that as the scary unknowns. Certainly. So I think one question I'm seeing in the comments is supporting like parents or grandparents who are living with diabetes, who might be having trouble with management. I think now more than ever, any advice for, supporting others?
Yeah, well, I think that the first thing is making sure people have the supplies that they need. And I think that the good news coming out of the diabetes community is that there's not a shortage of supplies of insulin or pump supplies or things like that, but making sure people have what they need. The other thing is, I think that one thing that can happen is that with everything going on, people, especially people who may be older or alone, and may get overwhelmed with everything. And so diabetes falls off. And so maybe helping parents and grandparents who may be living with diabetes with some structure around their diabetes management, helping them to make a list, a checklist of, okay, these are the 3 or 5 things I need to do today, and make sure and check in with them to make sure those things are happening. Again, developing these systems to give us structure can be really reassuring. And diabetes is while it's not perfect in this way, there are some things that we know that we all have to do every day. And so getting people to understand those things and to follow through with them, especially people who are older, can be helpful in keeping them healthier, but also giving them a sense of security that they're managing their diabetes to the best of their ability right now.
Yeah, I'm seeing a question that has actually also come up among the Beyond Type 1 staff, and I'd love to ask you one more about you are at home and suddenly you're hyper aware of anything that might be close to a cold or a flu symptom. You're hyper aware of your blood sugars. Advice for separating what is like over monitoring or maybe just over awareness from like knowing if you're actually getting sick. Where's the boundary?
Yeah, I think I suffer from that as well. And it's a good question. I think the first thing, I don't know where the boundary is, but but in terms of some strategies, the first thing that I would do is just take a deep breath. We have this amazing tool in our bodies that we have with us all the time in our breath. And our breath can be really helpful in just helping us to pause and helping us to be in the present moment and bringing your heart rate and your anxiety down. And so the first thing I would do is just take a deep breath and allow yourself to take a step back and said, well, and ask yourself, if my friend or family member came to me and told me this is what's going on, what would I tell them? Because giving yourself a reality check, or even asking your friend or family member, this is what I'm feeling. Is this concerning to you? Even if they're not medical experts, they can kind of give you a reality check of, that sounds like it's a little bit weird, or that sounds like something you told me 3 months ago. That can be really helpful. And then just, of course, and if you are getting sick, I would take precautions. I would, self-isolate. I would follow all of the recommendations that the CDC is putting out, and monitor yourself. But we don't want to go overboard both with our behavior, although I would prefer people go overboard with their behavior rather than their anxiety, and kind of let them tell themselves a story, which then catastrophizes the situation. Runny nose all of a sudden becomes something much, much worse in your mind, when the reality is you had, a really spicy lunch, and your body's just trying to make sure that you're, that spice gets out of your system. Yeah,
I think that's a really interesting distinction of separating like what you can do behaviorally versus what's happening that's like a story you're telling yourself, or the anxiety that you're experiencing. And I think for me, especially when it comes to like what's the right level of feeling prepared, keeping that on behaviors versus like stories has been helpful. So like going to the store and stocking up versus like truly feeling like you need to have 6 months of toilet paper, for example. One of those is coming from a story that you're telling yourself, and one of them is like, I'm taking actions that are like grounded in what I might need if something were to happen. So I think figuring that out is something everybody, diabetes or not, but it impacts diabetes when it comes to supplies, right? So we're seeing that too. And we've been having that conversation internally of like, we do not want to see what's happening with toilet paper happen with diabetes supplies, because it would actually be the thing that could put stress on the system. And to be totally clear, we have been asking, we've been talking to manufacturers. There's no issues, and we don't anticipate supply chain issues, but having that conversation with the diabetes community is important to keep hoarding from happening, but also making sure everybody who needs it as soon as possible has access, because it's so important and critical. And I saw a question about low income or underserved communities. And I think that those conversations are becoming increasingly not important. They've always been important, but it suddenly is at this fever pitch of how can we support one another? And everybody's trying to figure out how to both support themselves and also look outside and see who's most vulnerable and what we can do for them. So at Beyond Type 1, we're trying to help you find places that you can direct both of that energy, taking care of yourself and trying to take care of others. But it's interesting how I think, as always, the experiences of the diabetes community are in a lot of ways specific, but reflective of what everybody is going through, bigger than us as well.
And I think that what I hope is what we'll see in the diabetes community is what we've always seen, is a willingness to step up and help each other out. And and support each other both emotionally, but if we need to, also physically, with supplies and with other things. I really hope it doesn't come to that. We don't have any evidence to show that it will. And so kind of giving ourselves a reality check there of knowing that the supply chains are in good shape, but also knowing that you have a community behind you. And that's one of the coolest things about this community. None of us wanted to be a part of, but we are. And so now we have the pleasure of helping each other out when necessary, which is a really cool thing.
Yeah. And I think there are positive, on the flip side, I think we started this with a get off of social media, but I'd also love to bring it around to separate from COVID-19, connecting with the diabetes community online, especially if you are feeling isolated or have questions about diabetes or having specific challenges managing diabetes right now, is always helpful. Diabetes is easier if you feel connected to the community. So I think, any thoughts on the importance of that community and how to get connected right now?
Yeah, I mean, I think that the way that we're doing it right now is just being there and being connected to the degree that's going to be most helpful for you, but also making sure that you're doing it in a way that's going to be healthy for you. And I think that, there are certain mediums that for some people aren't healthy and certain ones that are. So, in reaching out, and, feel free to reach out to me and say hi. Feel free to reach out to Beyond Type 1. Feel free to reach out to the people who are active on social media, because, I hope that we can be a great resource in helping you to connect. And especially now that we're in the age of social distancing, location is kind of irrelevant, right? And so we can connect together in that way and be supportive of each other, both with diabetes, but also just with the current situation that we all find ourselves in.
Yeah, no, absolutely. I think we are very much on the same page here at Beyond Type 1. We are working really hard to provide resources that are answering all these questions, not just about mental health. Mark has a brand new piece published on Beyond Type 1 about COVID-19 and mental health, but also about how the diabetes community is being impacted, what to do if you think you are sick, when to get help, how to prepare, what to expect, what different organizations are doing to respond. And we're going to be building those as well. So if there are things that anybody watching wants to see or still has questions about, please don't hesitate to reach out to Beyond Type 1. We are here and really focused on this right now. And kind of all in this together, certainly. So not just the diabetes community, but everybody outside of that too. So unprecedented times, but I think leaning on what we do know and what we can control has been helpful. So any kind of concluding thoughts from you, Mark?
Yeah, well, I want to echo what you said, Dana. I would love to hear from the diabetes community what it is how I can be helpful to them, either in partnership with Beyond Type 1 or through my own organization, which focuses on mental health and diabetes. I've been thinking a lot about kind of how can I contribute, to help the community at this time, and really, I don't want to say improve mental health, but certainly support you in the challenges that we're facing right now. You know, we're all anxious, and I want to. That's okay. It's okay. It's okay to feel anxious, and it's scary, and we're all feeling that way. And you're not alone. But I don't want people saying I shouldn't feel this way or I should feel this way. You know, you feel what you feel, and we can't change that necessarily, but we can support you in that and make you feel like you're not alone in that, in whatever it is that you're experiencing. And I think that's the most important thing for me, is recognizing that, yeah, these are unprecedented times and they're scary, and it's changed very, very fast. We couldn't imagine having this conversation 2 weeks ago, but we are.
No.
But we're all in this together, and we're here to support each other. And I certainly am here to support everyone in this community and Beyond Type 1 in whatever way that I can. So please, you know, let me know what I can do for the organization, but also each of you individually who's watching. I'm happy to help in whatever way that I can do that.
Well, thank you so much, Dr. Mark Heyman. I think that there is going to continue to be value in having these mental health check-ins with our community. So we hope to be able to continue to bring some Q&As and put Mark sort of out there and answer some of our questions, provide some support for everybody's mental health as the situation continues to evolve. So know that we are here. Mark is there. Everybody's just doing everything we can. So thank you for tuning in. Mark, thank you for your time. We will talk again soon. And again, if we haven't answered a question that you have, please feel free to reach out either to the Beyond Type 1 DM or to Mark's DMs, or his email is also published on our website. If you go find his new piece on our website on Beyond Type 1. I also should say we have kind of a landing page growing on the Beyond Type 1 site. If you go to beyondtype1.org/coronavirus, all of our reporting, medical advice, supply chain information, and response, like disaster response that every organization is doing, is there, as well as things like mental health support and more. And that will continue to grow as time goes on. So check that out. And Mark, thank you again so much.
Thanks, Anna. Bye-bye.
All right. Have a good one, everybody. Thanks.